for preserving fertility is something that has to be done for many young people before they start their cancer treatment. And if they haven't reached puberty yet, there may be limited things that can be done. But what is important is that most cancer survivors want to be parents. And I'm not saying that everybody should be a parent or want to be a parent, but a lot of young people say that going through cancer puts an increased value for them on family ties and intimacy. So when we do surveys, about 3/4 of young men and women who are childless, and in one survey, 80% of teenage girls who were going through cancer do want children in the future. And one thing I've found over the years is that if young people were not told about the risk of infertility when they had their cancer, especially if they were already teens or young adults when they were diagnosed, they often feel really cheated and angry. Even if there wasn't that much that could have been done, it's a very important part of informing patients. And one reason for that is that the options to have a child after cancer often depend on decisions that were made before your treatment, and unfortunately we don't have any time machines yet. So a whole series of surveys that have been done in recent years have suggested that about 1/3 to 1/2 of young survivors don't recall being told that cancer treatment could damage their ability to become a parent. Now, with survivors of childhood cancer, sometimes that's because it was the parent who was told, but also there's this massive amount of information that you're given, and it's very difficult to remember all of it, especially when the issue is often life and death. But when women and men are given a choice to preserve their fertility, which for men may be banking sperm, and for women may be going through an IVF cycle or having some ovarian tissue stored and frozen, they have to make a very complex choice in a very narrow window of time. And often that's difficult. There's a whole series of information and costs in terms of out-of-pocket costs and what would be done and how would it affect your cancer treatment, and it's not something simple. Now, we do have a whole series of ways of modifying some cancer treatments to spare fertility, and they're generally with cancers like testis cancer or Hodgkin disease, where the treatments we have are so good that for an early stage or slow-growing cancer, we can modify treatment to make it less toxic. So, for example, some of you may be Hodgkin survivors, and you may have had the ABVD chemotherapy regimen instead of MOP or some of the chemotherapies that contain what we call alkylating drugs that are very toxic to sperm or egg production. Sometimes young women who are going to have radiation to their pelvis can actually have their ovaries moved up and away out of the target of radiation, and for about half of women, that may preserve their menstrual cycles. Sometimes women who have germ cell tumors of the ovary, which are rare but more common in very young women, or who have what we call borderline tumors or very early stage slow-growing ovarian tumors, can just have one ovary and tube removed, and later on they can get pregnant and carry a pregnancy. Some young women have precancerous changes in the uterine lining or very early stage uterine cancer and can be treated with the hormone progesterone instead of having their uterus removed. And for some young women who have very early stage cervical cancer, there is an operation called trachelectomy, which instead of removing the whole uterus and cervix, actually removes the cervix but leaves the uterus in place so that a woman can carry a pregnancy, although there are some risks, for example, of having a premature or low birth weight baby. And for men with early stage testis cancer, instead of having chemotherapy or a node dissection right away, some men go through surveillance where they have a series of tests to make sure that their cancer has not reoccurred for a number of years after their initial diagnosis. But though in doing that, they spare their fertility. Now, what can we do to actually freeze sperm and eggs? Well, men are lucky. It is actually relatively easy to freeze sperm, and sperm can be frozen for as long as 20 or 25 years and be unfrozen and be used to create a healthy pregnancy. For boys who haven't reached puberty, there are some experiments of taking pieces of tissue from the testis and freezing that, and hopefully later on being able to extract sperm cells from it, or even transplant it back into a young man's body, or even some people have talked about transplanting it onto a mouse that has no immune system, so you would actually have your mouse be the surrogate father for your sperm cells, because the tissue would grow human sperm cells on a mouse. But we worry about things like a mouse virus getting into the sperm cell or something like that. So that's very experimental. Young women who are past the age of puberty can go through a quick IVF cycle, and that might delay their treatment by 2 or 3 weeks, which for acute leukemia is often not really possible. But for most other cancers, doesn't make that much difference. And they can then freeze embryos, although if they don't have a husband or partner yet, they will need sperm from a donor to create an embryo. And that creates a situation where later in life, they may into a relationship and their partner says, well, you've got these embryos with your eggs and donor sperm. Why don't we get an egg donor and create embryos with someone else's eggs and my sperm? And I actually have heard of 1 or 2 cases where there was a big conflict in the couple about what to do. Luckily, egg freezing in itself, freezing unfertilized eggs, is improving a lot. And although it still isn't as good as embryo freezing, it does offer single women some opportunities to preserve their eggs. And some girls actually have parts of the ovary frozen before their cancer treatment in the hope that later on, when they are free of disease and want to have a child, that those fragments can be transplanted back into their body and will produce eggs that can be harvested and fertilized and can produce a pregnancy. And around the world, there have only been 5 or 6 births through that technique. So again, it's still very experimental, as is trying to freeze the whole ovary so it could be someday reconnected to blood vessels and put back. Now, after you've had cancer, there are a number of pathways to become a parent. The one we love to see is that you recover or keep your natural fertility, and that depends on if you had chemotherapy, what drugs were used, what was your total dose, and how old were you. The younger the better in general, and also a field of radiation. So if you had radiation close to the pelvis for a man or a woman, it's more likely to affect your fertility. If you did freeze sperm or eggs or embryos, you have the option to use them with infertility treatment, or sometimes women may, for example, be having some trouble getting pregnant and may still be candidates to have some hormone stimulation to help them produce more eggs and may be able to have a successful pregnancy that way. And then there is what we call social parenthood, which means that you aren't the genetic parent, but you are a parent through adoption or through using a donated sperm or egg, or having another woman, a gestational carrier, carry a pregnancy if a woman no longer has a uterus, or for many of us, through being a step parent. Now, for men, one issue is that the way you usually get a sperm sample to freeze for sperm banking is you collect it through masturbation and then you freeze it. And since many of the guys who are in that situation may be young teens, that can be a very difficult topic for them to talk about with their parents and their healthcare providers. One thing we know is that sperm banking works very well, but only maybe about 10% of men ever go back and use their samples to have a baby. So it is a somewhat expensive kind of insurance to have, but for some men it does make the difference between being able to have a biological child or not. And it's always best to bank sperm before any radiation or chemo, because then the sperm cells are less likely to have any kind of genetic damage. And it's very hard to predict in men who's going to recover fertility. For example, young men who have testicular cancer are the most likely group to have very few or no sperm cells in their semen when they're first diagnosed. But after recovery, they're the group most likely to recover close to normal sperm counts.